Hi, I'm Satish Misra. I'm one of the cardiac electrophysiologists with Atrium Health's Sanger Heart and Vascular Institute.
And I'm Ashley Stewart. I'm one of the nurse practitioners with electrophysiology at Atrium Health Cabarrus. And we're here to talk to you today about different medications you might hear about through your team for treating your atrial fibrillation.
One approach for managing atrial fibrillation is to suppress the AFib altogether with medications. That's an approach called rhythm control. Patients who choose to pursue rhythm control or suppression of their atrial fibrillation typically include people who are symptomatic with their AFib, people who have heart dysfunction, or people who have difficulty managing their atrial fibrillation due to rapid heart rates during their AFib, but slow heart rates otherwise. You'll talk to your doctor and your care team about what approach makes sense for you. There are many potential drugs that you may be placed on to help suppress your AFib. One group of drugs includes drugs called flecainide and propafenone. These are drugs that are generally safe and well tolerated for suppression of atrial fibrillation. They do generally require getting some cardiac testing prior to starting them to confirm that they're safe for you to take. Another group of drugs includes drugs called Tecocin and Sotalol. These are drugs that are also pretty safe and well tolerated for suppression of atrial fibrillation, but do require a hospital admission, typically of 3 days, to ensure that you're tolerating the drug, because there is a small risk of causing abnormal heart rhythms. Another drug that we sometimes use is a drug called amiodarone. That drug is also effective for suppressing atrial fibrillation in many patients, but does come with a number of potential long-term side effects, and so if that's the drug that you choose to use, will require careful and close monitoring over time. Ultimately, the choice of drug that you use to suppress atrial fibrillation will be tailored to your individual circumstances and should be based on a thorough conversation with your care team. Another important conversation that you'll have with your care team is the best way to prevent stroke associated with atrial fibrillation. The decision about whether to go on medication to prevent stroke is a very individualized decision, looking at risk factors that may increase your risk of stroke with atrial fibrillation, as well as things that may make going on medication of higher risk. The most common medications that we use for prevention of stroke associated with atrial fibrillation are called anticoagulants. These are medications that help thin the blood and prevent formation of clots in the heart that could cause stroke. Common drugs that we use are drugs like apixaban or Eliquis, dabigatran or Pradaxa, rivaroxaban or Xarelto, and a variety of others that are typically once or twice daily pills. These drugs don't require routine blood monitoring and are generally safe and well tolerated, with comparable bleeding risks to just being on a full dose aspirin. Another drug that's sometimes used in select patients is a drug called warfarin or Coumadin. This was traditionally used before the other drugs that I mentioned became available and does require frequent blood monitoring as well as careful monitoring of the things that you're eating because of potential interactions. For some patients who can't tolerate being on a blood thinner for any number of reasons, we may talk about procedures where we insert devices into the heart to help prevent strokes associated with atrial fibrillation. If this is something that would be appropriate for you, you and your care team will discuss the next steps and evaluation for that procedure.
One important part of managing your atrial fibrillation is rate controlling medicines. These are medicines your provider may prescribe for you to help lower your heart rates when your heart's out of rhythm or in AFib. Many people in AFib have extremely fast heart rates, and we use these medicines to bring your heart rate down. It's important to know that these medicines can also lower your blood pressure though, so daily heart rate monitoring and blood pressure monitoring is recommended. When it comes to rate controlling medications, there's 3 main types of drugs that we use: beta blockers like metoprolol, calcium channel blockers like diltiazem, and a third medication called digoxin. We use these medicines to help lower your heart rate, and it's important to know that they come in both extended and immediate release forms. Talk to your provider about which is better for you. Overall, you may be prescribed medications from both categories, both rhythm and rate control. Our goal is to eliminate atrial fibrillation as much as we can, but we know that sometimes people still continue to have the arrhythmia, which is where the rate controlling medications come in. So know that you may be on both rhythm medications, but rate controlling medications as well.
Over the past couple of minutes, we've covered a lot of topics. We talked about medicines that can help control your heart rate when you're in atrial fibrillation. We talked about medicines that can help suppress AFib altogether. And we've talked about medicines that can help prevent strokes associated with atrial fibrillation. At Sanger, it's really important to us that we partner in your care and help you understand all aspects of the management of your heart health.
We're here to help you, so give us a call anytime if you have any questions about your medicines or your atrial fibrillation.